Karen as president and
I pledge.
oh, fun. I still own the rest of it.
But
Yeah.
we're doing.
I think she did. Yeah, just figured, see if we could reschedule.
Get the sun. That's fun. That'd be great.
Yeah, because I'm gone, we're headed to Florida for vacation Monday, but then, and then I'm traveling for 3 weeks.
Okay.
Or I actually take next month.
I'm so.
There we go. Not bad.
I thought it was gonna be less travel with New Jersey, but
In public.
it's less travel like on a regular basis, but longer travel for each trip, I guess, is so far.
Darian, you're back. Still feeling cruddy, but I'm here.
Good morning, everybody.
That's food, get everybody's down.
Yeah, we've,
Mine is.
Yeah, I'm not quite sure what it is.
Yeah, I asked you.
Oh, you
No, I'm not sitting here.
I don't
Looks like you guys got everybody in.
Yeah,
And
I don't know the laws.
I little one had a fever for like
we'll call this, we off mute, yep, we're good.
Okay, recording?
Recording. Great, thank you. We'll call this meeting to order. First item on the agenda is a review of the agenda. Any changes, comments, questions?
Can I bring something up?
Sure.
It's up to you if you want to hold the meeting in December. So nothing much is going to change from now until then.
Okay,
Holidays and all that.
let's add that at next meeting
that-
discussion.
yeah,
and
absolutely.
we can Do that, that. would be
Possibility.
easier. Anybody else? For agenda, okay, we'll move to the approval of the October 14 meeting minutes. Does anybody have any changes? No.
To accept as presented.
I second.
All those in favor say aye.
Aye.
Aye. Motion passes. Do you have anybody signed up for public comment?
I don't see anybody. Mhm.
Okay. And also for the record, Ian Smith is joining us by Zoom today. Hi, Ian.
Oh, hi.
Sorry. Okay, so first is the review and update of the current bylaws. The only question I had, Gino, was on, because I think there was an additional change that you made from what we discussed, probably, I think it was two
meetings ago, yep.
2 meetings ago.
Sure.
And that is on the public comment
Mhm.
section. Can you explain that? Because I couldn't quite follow it.
So the public comments section right here. So the agenda shall be posted on the Board of Health, sorry. It was actually Dr. Reedy who was working on the minutes, or I mean, on the bylaws
Okay.
that pertains to the Board of Health. Okay, so if you're referring to, are you referring to this document right
Yeah,
here?
I think this is it.
Yeah, so this is an example of some bylaws that are currently being used within the county. So this
Okay.
is actually the County, the Open Meetings Act, Jefferson County Board of Health current bylaws, and then the Jefferson County Commission and how they handle public
Right.
comments, and whether or not you might want to adopt some of the language from their bylaws when it comes to public comments.
But like, I guess what the question is, because we didn't talk about this last time this was presented, is what are we trying to accomplish? What's being asked of us?
So the question, Dr. Reedy, is what are the changes you think should be proposed for public comment?
And that's. We can leave it as it is, but it's a little unclear exactly what information we need. And then also just to have some discussion is, so who has a right to do public comment? People that live in Montgomery County, Maryland? You know, is it that don't work here? So that's not been an issue, but might, you know, the thoughts are it's citizens of this county or residents of this county or people that work here, but not simply a special interest person from, or whatever the interest, from somewhere else. That we also, I don't think have you know, any clear way of identifying people who get on Zoom. We have a clear way of identifying them.
No, they can use.
They go to the waiting room and I either let them out or don't.
But
let
it's
them
a
in.
public
But
meeting,
it's-
so it doesn't matter if you're
But if they want to speak,
Yeah.
a resident of Timbuktu.
but if
let them in,
if
yeah.
they want to speak, then is there certain information we're requesting up front, who they are and their.
No, we do have to, we do ask them for their name and where they live, like their city,
And ideally beforehand, we have like a list
right?
right here that we use.
But would we also, it might be of interest to this board to have a public comment from somebody who might be a vendor, who might live in Indiana, but is it still a vendor to us?
Another thing that, let's say, we have another company interested, manufacturer interested in building here, and there's pollution, and this may fly over to the next county or, next state, and they want to have comments. I don't think we can forbid them to comment.
it's our decision of whether or not we want to accept what they have to say. I mean,
Absolutely.
it's what it is, but they're allowed to speak.
You know, just, it's a matter of, I think, subject matter of its own topic. And it's germane to Jefferson County Board of Health interests. And I think that's the overriding qualification.
And then another issue related to that is, I thought we had a 30-minute limit on the amount of public comment. But is that in the bylaws? Did I miss it?
No, there's not a total of 30 minutes, doesn't say that, but it is in the
It's written on
agenda.
the
It's written in the agenda, but it's not a part of the bylaws, yes.
And,
But
you know,
great-
so it could be, it's up to the chair.
Absolutely.
Limit, you know, to set a time frame for the discussion in the agenda, but it, you know, it shouldn't. I mean, it's up to the chair, then it's not arbitrary, it's,
Right.
you know, but it's, but just addressing that, because seen some places where they,
It does address that, it doesn't, I don't think we necessarily have to put the 30 minutes.
And that, again, it does say, it says the chair, it is up to the
Yeah,
chair.
because
to
when
run
we
it.
had the comment period on the mask, we extended it to, I think it was about an hour or so, so
Exactly.
that was.
If it's necessary, we will have to extend it.
So, and it does say in the bylaws, just with a quick review again, and I've seen this previously, that does require a name. Of the group that they're representing, if they are representing a group and not themselves. And a method for contacting their representatives beyond who is speaking within the bylaws, so. We just want to make sure that these things are all ironed out, that's all.
Yeah, and I think it's
That
really
they're,
good.
that they're confident in them.
that's important.
Yep.
I don't think we've had any challenges with that in the public comment period through Zoom or anything.
And we've, so far, when we've had Zoom comment, they've identified themselves, so. It's tough to reach out and grab them.
It's a small county.
It is.
All right, well, thank you,
Yeah,
appreciate
yeah,
that.
more just kind of discuss the issue, because it's, who knows?
Yeah,
And
appreciate
then
that.
the rest are just mostly are grammatical errors, spacing errors, plural versus singular usage, things like that, that we just want to make the changes to that so that it reads a little bit more smoothly and a little bit more professionally.
Okay. Well, Zedby, I mean, everyone's had the 5-day review requirement met. We obviously have already spoken about this again 2 meetings ago. So is there a motion to accept these changes, amendments to the bylaws?
I move to accept these changes to the bylaws.
I'll second.
All those in favor say aye.
Aye.
No opposed, the motion passes to accept the changes. Thank you.
Thank you.
Staff for doing that. Update on vacancies, social worker and sanitarian.
So social workers still vacant. Not getting a lot of, I have it in my administrator notes that, not getting a lot of response to that posted the way it is. So I reached out to Shepherd University's, the dean of the social work program over there. Spoke with her for a few minutes and she said to let her know of any opportunities that come forward. So I forwarded her the position and she said she will pass it on to December graduates. And obviously there's a lot more May graduates than December graduates. So it may be something that hangs on until the next major graduation period, which would be in the spring. But hopefully one day we can staff a QRT, quick response.
And this
team.
is one of the grant.
This is a
one of the
grant, yeah,
grants.
and we haven't spent any money on the grant yet because we just haven't had the ability to staff it and staff this quick response team with social
So
worker.
the grant just kind of hangs there
And,
until,
yeah, they haven't paid us.
It hangs there until it expires each year.
Yeah.
so it's an
And then-
annual.
and then, so like the one for this year, which would have started beginning of September. We have yet to hear from, so we actually do not have a grant.
Mhm.
If we knew that would be funding that's coming for sure, but a few years ago. We applied for it and we were turned down, no explanation. So it's so that. Assumption that it's gonna be there is not always a correct assumption.
But it's absolutely something we would not staff without guaranteed.
Right.
funding.
And there's going to be a huge amount of money
Yes,
rolling into this area that several corporations are already positioning themselves to harvest this money by applying for every grant in the world.
For what purpose?
To harvest money, no, for opiate response.
Oh, opiate response.
Yeah,
Okay, gotcha,
Yeah,
gotcha.
so
I
all
was like,
this, yeah.
to do what?
No,
Okay,
yeah,
got
so
it, got it.
so this is separate than the state budget surplus. This is,
Mhm.
this is money that's gonna come from this lawsuit.
The lawsuits,
And,
okay, yeah, I haven't talked to
Yeah.
Patrick
it's,
recently about it.
To continue on to that, though, with the lawsuit money, that's going to be dispersed through regional boards. Regional boards that will be appointed through the Attorney General's office, sounds like, and through and
Interesting.
local politicians and the legislature.
This is very similar to the tobacco.
Very similar.
It is,
So if we wanna get a chunk for the Eastern Panhandle, as we all know, is the, you know, the neglected part of the state,
Right.
contribute the overwhelming majority of money. And get the least amount per capita back.
yeah,
This is an opportunity for any individuals.
So how do
Particularly
we-
Board of Health people to,
can
Get
people
on
that
that
sit on
board.
this board sit on that board too, or? is
I
it-
don't know if that's a conflict of interest yet, but I'm sure that we can hopefully find someone who would represent our county well. I don't think myself and Dr. Reedy or any of the board members would be allowed to sit on that.
How do we find out more information?
So I'd reach out to Patrick Morrissey's office, and that's who I've been speaking to about it,
Okay.
but, and he said that he's trying to, because as we all know, he's a resident of
Sure.
Jefferson County, and we want to make sure that, he wants to make sure that we have the right people in place to be forceful when that time comes.
Do you wanna call Patrick?
Sure. Just ask him, yeah, and say, hey, how do we get the right people on this board?
I'll do that.
There's also, so Berkeley County, with the health department playing a prominent role, partly because most of the grants so far have had to come through the health department,
Mhm.
but their county commission has been even further ahead of the curve in having a resource center for where they've hired several people to be drug counselors.
Mhm.
And so they're and also participating with West Virginia University Medicine, which got Berkeley and Jefferson got $2 million from the governor's special fund, this in Wyoming County. That they have done a lot and are on a lot of different things. So
Okay.
the challenge hasn't seen like that.
Okay.
And the sanitarian vacancy was reposted last week. So because the state is planning on doing trainings in February and March for food and septic. So, and the rest are going to be available virtually, so we can have somebody trained sooner.
Can we add to the agenda for next week, so going back to this regional board thing, just make that a piece of the agenda, so we can just follow back up on that.
Sure. That moves what I said earlier.
What does that mean? Oh,
I'm kidding.
going forward, going forward. What's the timeline on that board appointments and all that kind of stuff?
I got a feeling that it's going to be late winter, early spring, so as the legislative session begins and in and around that time frame, because that's, I think a lot of that's going to have to be appointed through the legislature.
Okay, but it's like not next week.
It's not next week, no, not from what I've been told.
I'm in the private sector, everything's next week or
Yes.
yesterday. So.
I'm well aware.
Okay. All right, I guess we're going on to Charlie.
Hi, good morning, everyone. So, you should have the financials for both September and the preliminary statements for October. Key metrics for September, bank balance, $604,800 roughly. So we are in compliance with reserve requirements. Accounts receivable balance, $163,000, average days to pay 29 days. As far as significant receivables, in September, we still have $121, almost $22,000 due from West Virginia Treasury, mainly due to threat prep. Other than that, there were no other significant receivables. So in September, West Virginia Treasury was 75% of the receivable balance. Year to date for September. Revenue, roughly $274,000. Salaries and wages, 228. Expenditures, $83,000. That gives us a deficit of almost $37,000. Again, that's year to date for September. If you look at compared to our the budget, revenue is below target by 7%. For this time of year, that's not surprising. Total salaries and wages below what we budgeted, 7%, and operating expenses below budget by 4%.
So what's our so the 7% that we're now. In terms of our deficit, if you will, what is that, is that just not?
That's
is that-
cyclical.
It's just cyclical.
It's
Yeah.
cyclical. Our big revenue generation period is usually in the spring heading into summer,
Okay,
mainly from the environmental side. But we're able to, when we get to
Yeah, and-
October, we can discuss.
Yeah, because
the way we do it.
that's going to increase a little bit.
Yeah.
That,
okay. Where do we end up, sir, and I guess it's in here somewhere, where do we end up with the septic fees? Compared to like, you know, I know we reduced the budget items for that because we didn't expect to have as much activity this year, but.
I don't think they've been reduced at all.
No,
So it's been consistent,
it's been consistent, if not above.
okay,
Mhm.
all right.
That has not slowed down.
No.
Stay cheaper in West Virginia.
It's still cheaper. You got it.
Alright, switch that.
all right, October. For October, bank balance, $626,000. Again, still in compliance with reserve requirements. We see a significant decrease in accounts receivable. It's down to $69,000. Average days to pay is up to 31 days. Significant receivables.
That's not bad.
Yeah, no, it's really not. Significant receivables. West Virginia Treasury down to $16,000. Yeah.
Well, there's a quarterly billing coming up, so that'll go back up. again.
Just ride the positive.
Yeah.
It looks great right now. It looks great right now.
There's a YouTube video that my husband sent me yesterday. It's this little girl going, shh, positive vibes only.
It'll still be positive, it just will change it a little bit, it'll look strange.
But
We bill out
That's
this
the first time
grass,
we've seen it that low in a while. So,
probably a year or more.
yeah. There were no other significant receivables. The largest receivable was $1,600, which is below 10% of the total balance. All right, so October, just looking at the month of October. Revenue, $35,000, salaries and wages, 77 or almost $78,000. Operating expenditures, almost $30,000. So for the month, there was a deficit of almost $73,000. So some of that is there's a mismatch in timing. So their vaccines were purchased, but we hadn't necessarily received that revenue from the vaccines. So year to date, so this is July through October. Revenue, $309,000. Salaries and wages, $306,000. Operating expenditures, $113,000. So that gives us a deficit of $109,000 through October. So if you want to compare that to the budget, revenue, we're below the target or budget by 13%. Salaries and wages, we are below budget by 8%, and operating expenditures were above what we budgeted by 11%.
Help me understand the 13% budget to actual variance. So on the revenue, so July through October, 309,000 revenue, budgeted 1.5.
Yeah, so some of that is going to be permits. We don't see a lot of that revenue until the second half of the year. Some of it's timing of grants that we've budgeted for. And then services provided, so like vaccines, we've had all those expenditures, but we haven't received the revenue associated to those yet.
So is that percentage coming from a different kind of analysis than this?
Yeah, so it's coming from the budget versus actual report. So, there's a profit and loss budget versus actual.
Yeah,
and-
that's what I saw here.
Okay, and,
So it just seems like that 309,000 revenue July through October compared to the 1.5 budgeted, it seems further off than the 17%. That's kind of, I guess, 13%.
So through October, we are 33% through the year. And so if we look at total. And. So total operating expenses were, oh, we're looking at revenue though, I'm sorry.
Yeah, I just want to kind of understand what I'm missing.
I was looking, I'm trying to figure out which one you're
Yeah,
looking
so,
at,
on
so on page
Yeah.
one.
Yeah,
of
page one.
October, okay,
Yeah, the revenue, 309, July through October.
that line, okay, got it.
And, you know, a budget, so, you know.
Yeah. Okay, so, July through October, I'm looking at like, we're 33% through the year, so I would really expect that percentage of budget to be right around 33%. But we're really at 20%. So we are, so we don't have the revenue we expected. So that's where I'm getting at 13%. It's that 33% that I expect us to have versus the 20% we actually have.
So 33% of the revenue should be in, theoretically speaking.
Yes,
because we're 33% through the year,
Yeah.
but only 20% of the revenue has come in.
Okay.
So that budgeted amount is the total annual budget,
Oh, this,
total annual revenue.
Oh,
okay, so that second column here is in a year to date.
That's not year to date, that's budgeted for the.
That's what I was missing.
1.5,
Yeah.
roughly 1.5 million for total annual revenue.
Yeah, appreciate that.
And if you looked at saying, oh, it should be 30% or it isn't, that's with the assumption that every month is equal as far as
correct.
proportioning it, whereas we know that our environmental fees, the licensing for the whatever you call it, permitting, those aren't due till the end of our,
We have
the
some
beginning of July.
calendar year.
so we get those big payments of up to $200,000, $200,000.
Yeah, it's a lot that we build
Yeah.
in like April, May, June, but we do have some that get billed for the end of the calendar year, but it's a lot less.
Yeah, so, for example, fees for permits, we've budgeted $254,000. But at this point, we've only built out 48,000. So
Okay.
we're still expecting another $200,000 just from that line item alone, and most of that will be in the second half of the fiscal year.
Most of our other expenses, the assumption that it's every month's the same, are probably a reasonable assumption. That the permitting fees is clearly skewed towards.
Like the budget, the revenues do this, the budget does that.
Yeah.
Or-
Yeah,
So usually when I look at it, I start with what that even percentage, like, okay, we're 33% through the year, but we're actually at 20, so why is that different? And does that make sense? So that's usually my train of thought.
So you take that 1.5 kind of times 0.33, so that's how far through the year we've
Yeah,
accrued. And then compared it to the 291,000, and that's the 13% differential.
Mhm.
Okay,
Do you think that, the assumptions for inflation are adequately accounted for in the budget, or do you think that inflation is running a little hotter than the budget might have anticipated?
I don't know. It's a good question.
But the good side is that you guys are below on your expenses. So you've been managing that too, so that's been good.
Correct. That's just something to think about, because
Well, these-
that's one of the variables that you can't really even, like, sometimes.
No, you
because
can't, yeah.
It's unexpected.
Believe me, I saw all the vaccine purchases this month go past my desk and they were quite significant. So but that's something that we have.
Increase the fees too that we were.
Yes, yes, and we did that too. And we've also been steadily billing medical insurances and receiving payment for those, which has been nice. And I think she's seen the numbers of that change a little bit than they had been previously. So we're slowly catching up on that.
But our biggest expense is salaries,
Oh,
and we can't simply make cost of living adjustments.
Right.
That's all got to go through this.
That goes through the state.
Which remains very difficult because, like every other industry, getting personnel, we're already below market rate. It remains as of this morning even.
Yes.
Well, that's one of the interesting things about West Virginia is that the cost of living throughout the state is certainly not uniform. And yet the state government sometimes acts as if it were.
That's what we deal with in education funding too.
It's another argument for locality pay, which I know is not very popular in the legislature.
Well, it is for our.
It is for like 5 counties. For like 5 counties. it is.
Our guys fight for that all the time.
It's absolutely.
But it becomes a domino
Police
effect.
and teachers.
If you're short, whether it's child protective service or whatever, if you're short on the number of people, there's a point at which the few you have says, I can't hold this load anymore.
Right.
And maybe someone else feels the
This is a
same.
few times the democratic process doesn't work in our favor.
Yes.
So what process?
Democratic process.
Well, it also goes to the choice of lobbyists and the,
In
Austin.
that's on your contract, Karen, so we will take care of that after that contract expires. That's a little inside baseball there.
It's a small irritation.
I'm sure it's not that small. You and I are in 100% agreement.
Lord, all right. So I guess, any other questions on the financials? All right, is there a motion to accept the September financial report?
So move.
Second.
All those in favor say aye. Aye.
I
Abstain. One abstain. And we will move along to the agency activity report.
Thank you, Charlie.
Thank you. It's a
Thanks,
wonderful
Charlie.
day.
Health administrator.
So just a couple of housekeeping things, waiting for one more part to upgrade the internet, waiting for a 100 megabit 48 port switch. Once we get that in place, we will then be able to upgrade to a lot more cloud computing and have 100 meg system, which would be wonderful. Which is something everybody in the private sector takes for granted, but here and state level stuff, it's probably years later. I had a little note to myself that I've learned more about network equipment than I ever thought I would, so. Annual audit was this past week. Annual audit was performed by Tina, Lisa, and she said on her way out, no marks, no bad marks, nothing major, and nice clean report will be available to us probably in December.
Is that conducted out of McCuskey's office?
No, her name is Lisa. I can't think of
We
her
have a
last name.
private.
It's a private
Private
CPA,
agency.
yeah.
All right.
She's out of Milton, West Virginia.
Yeah, okay.
So,
You have to accept bids for that.
yeah, so she had bid and she was the best bid and she had 2 years prior experience, but I think after the 3rd year, they can't bid again. So we'll probably be getting a different auditor next year. So we'll see.
Okay.
I think you have to, because I think they try to reduce familiarity.
Right.
So, but I'm not positive on that. That's something I have to look at.
We have a state auditor. I wonder why the state auditor.
So we were also audited by the state auditor,
You
by
were?
McCuskey's office, yes, for our grants, our pass-through, federal pass-through grants and our state grants.
Okay.
And that was in July and I've heard nothing since then, but everything went good, so.
Great.
Looking over prior folders, sometimes when we get state audits, it's a long time till we get the result.
Yeah.
Having the private, we get it in a time frame within the, close to the year being analyzed instead of 2 years later.
Right, but they also, look, they're having the same personnel issues that everybody else is having.
And same thing as last time, we'll have to notify the previous member of the board to make sure that he receives a copy of the audits because
Okay.
his name was he signed off on a lot of those, on those financials himself as a member of the board. So just like we did with the prior board last year, we'll do the same thing and make sure that they're, understand that everything was clean.
Okay.
So should we discuss what we did last night, Dr. Reedy, real quick?
Sure.
I'll do that. So last night we held a vaccination clinic with Jefferson County Public Schools, where we provided vaccines for students that needed them to continue, be able to continue with school. So there's about 200 students roughly that were not up to date on their vaccines, and they will not be allowed to attend past, I believe, December 2nd.
These
So
are like the standard
it's standard, very standard.
So these were
Childhood vaccines.
about 200 that they did not have documentation of.
Correct.
So some of them had documentation that they just hadn't turned in.
Correct.
But we saw 34
34
different
last night.
students and a variety of vaccines. So interestingly, about half of the people who showed were Hispanic, which is not representative proportionally of those that were on the list.
Yes.
But
They showed up.
we did have a interpreter here, and it worked well. We were not expecting that kind of language breakdown. The students all spoke English, but some of the parents didn't.
Okay.
So it was a demographic we know has changed, but this was first time that it, here it became so prominent.
So we were well prepared with our interpreter who's on staff as a part-time temporary student employee. So we were able to provide that service, and it was great. She's excellent. So someone Dr. Reedy had recruited. So wonderful. But I'd like to thank a few people. Big thanks to Wendy, our finance tech, and we also received a little bit of support from Marty Freeman, the former administrator here on our audit. And then for last night, the people that participated, of course, with Dr. Reedy, myself, but also Robin Pence, our LPN, Casey and Spring from our front desk, and our RNs, Ardith and Lindsay, and then also Bevan and Lexi. So they did we all stayed several hours past our regular work shift to make sure that the children got what they needed, right, to provide that level of service for the community. So big thanks to them all.
We pass along our thanks, we appreciate it.
Thank you. The big one, I think we all know this, Steve Stollifer's mother died. Name's Nancy Stollifer, if you guys did not know. Retired as a nurse from the Jefferson County Health Department with 28 years of service here. She worked in the office, just a few offices down from mine and down from Dr. Reedy's, so. That's very nice. I did not know that until Steve told me when he came in and spoke to me a few months back, and he let me know that he'd been in this office many times before when his mother worked here. So that's nice, and I don't have anything else.
Very, very nice.
Yep.
She was also served in the AWACS
Mhm.
back in the day too.
Super cool.
She's an awesome lady. Epidemiologist.
Yeah, wait a minute.
Yeah.
All right, so today we're just gonna be going over some of the epidemiology stuff going on within the county. Starting off with the respiratory pathogens, this chart shows influenza, RSV, and a bunch of other combinations.
Gotta be sure that's close enough, so that
Okay, sorry, I'll talk about. We can see RSV is much higher than it normally is. Same with influenza at this time of year compared to last.
the two, go back. So show which ones are.
So can you see them? Yeah. Okay, so this one right here is RSV, and you can see. So right now where it is in November compared to where it was last year, there's a significant difference, as along with the flu as well. So flu is up here, where down around this time last year it was around here. And granted, COVID does have a part to play in that as well, but numbers are significantly higher this year. All right, looking at COVID numbers, so from September to now, we're definitely moving in the right direction. It's trending down, which is great. We can see that in the state as well. Slowly everyone's starting to shift green, and hopefully it keeps moving in that direction, in that downward trend. So with this, just looks at the noticeable changes related to COVID. So 63.9% of new COVID cases were reported weekly out of 100,000 people, where last month it was 231. Out of all hospital beds in Jefferson County, 5% of patients have COVID. So that's within the hospitals within Jefferson County. Weekly, there are 8.5 patients with COVID admitted to the hospital per 100,000, which is great, super low. And then 79.4% of the county is populated with at least one vaccine. And then this talks about the water sampling that we kind of touched on last week, just kind of showing that it also is seeing low and trending downwards, which is kind of what we saw on the monthly trend with the state as well. So it just kind of confirms that with a little bit of a different light on it. All right, now talking about flu. So this is in 2021 to 2022. So not this season, but the previous. This season that we're currently in is 2022 to 2023. So you can see week 40, which is about, I believe, mid-October. Pretty low numbers, and the majority of it happens in end of November, December, January, February. But looking at it compared to this flu season, we're drastically higher, which we kind of touched on a little bit, where we are going to be seeing the flu a little bit earlier, which is what we're seeing in the numbers in hospitals and positive tests. And these values are actually from hospitals and laboratories. So these are just positive confirmed tests. All right, and then looking at the percent of the population that's vaccinated for the flu, and specifically in the eastern region, we can see that Jefferson County, which is right here, is kind of leading the way. We are the highest in all of the categories if we go through it. But this is just in terms of flu vaccinations. All right, and now talking about RSV, which I'm sure everyone has heard about at this point. So the percent of the total weekly emergency department visits that include RSV in the discharge diagnosis. So we can look down here at the year, it looks at the same like weekly period. As mentioned, it's getting extremely high, so it's something to take into consideration when going out and about, especially if you have young kids or adults.
Yeah, so does it hit adults? Like, does an adult get RSV? Because I know it's very dangerous for little kids, obviously, to get it, but like, do adults actually get diagnosed with it?
Yes, so now they do. Most of my career, they were not.
Okay.
We didn't have a convenient way for checking it, but over the last 10 years, it's become more obvious as testing has been easier, as it was being picked up more and more in adults, and now that it's being looked for, we find it's across the age groups. But it is more just like that first slide, all the different respiratory viruses, it was one of those. We weren't looking for it, so it didn't present any differently. Since a little over a year ago, when you go to emergency rooms or urgent cares, when you get your COVID test, it also tests for influenza A, influenza B, and RSV. So these numbers are actually really valuable numbers. It's people that were, tested, had a respiratory illness, and they got tested for COVID. And it also didn't show much flu or RSV until now. And it's showing lots. Before you had a negative COVID, you kind of stopped there. But now it's if you have a negative COVID test and you're sick, it still could be COVID. It just hasn't shown up on the test. But it also is highly likely at this time with the incidence in the community of being RSV or flu. And the important thing, especially if you're medically vulnerable, if it's flu, you may want to get your doctor to prescribe you medication for it, which can help decrease the seriousness.
All right. So looking at monkeypox, we're continuing to trend down with that as well. It's just something to take into consideration, think about. It is still out there, so just take precautions. All right, and now talking about the opioid epidemic in Jefferson County. So this is the year 2019. Granted, this was the beginning of COVID, so it is something, make sure the numbers might not be completely accurate. But West Virginia, unfortunately, is the highest state out of all 50. And then So this is the year 2019, and then looking at 2020, it looks like we might have gotten a little better, but it doesn't. We actually just got darker. And then we can look at so this is just, this next chart is just looking at this region, the states that are surrounding us. So West Virginia in 2020 has a death rate of 81.4. Whereas the closest one behind us is Kentucky with 49.2.
81%.
No, so it's a death rate.
Out of a thousand, out of 100.
So we are,
Population.
No,
yeah, no. So what that does is it just makes it,
But what's that become 1,400 deaths,
yeah,
you know, which is.
Okay, gotcha.
yeah, and the reason it does that is just because each state has different populations. So whereas our number, like the 1,300 deaths, isn't as high as other states, but with our population, the rate is.
As you could see on the prior maps, they had to invent a whole new category for West Virginia.
Yeah, no, they had to create a whole new color for us in 2020.
That's been going on for quite a few years.
Yeah,
2020 just made it worse.
yeah, no,
Stay home, and nothing to do.
and that's it. That's not the presentation.
Thank
Yeah.
you.
We will be giving more opioid data.
Do we have our county data on opioid?
Yes, it would present that. So Jefferson County, is not as bad as some others. But, we have about, 22, 23 deaths a year from, opioid overdoses.
So then I thought that,
How many?
22, 23. It fluctuates every year. It's been relatively stable the last few years. It did go up the first year of the pandemic. So 2020, there was an increase in opioid deaths. Last year was pretty much stable. Every now and then there'll be a press release about, oh, we're better compared to the prior year. It's like, okay, last year was awful.
Right.
Is that a trend? Well, we're hoping so, but it's gonna take time to see.
So I think that's just something like for this regional board stuff that we're talking about is like, I think we need to make sure we have the numbers, especially compared to the other 54 counties and just helping build our case, you know, make sure that proportionately at least we're getting.
So I will send to the board members, several other goals and charts on.
So that means that, having somebody on that board that disperses the funds, West Virginia should be, on a per capita basis.
should be the most funded, absolutely.
Also, would you please lay out the process of how do you spend money on these cases? I have a lot of issue with not knowing how many patients or who we attend to for. It's just we have program here before and we only know we spend the money and we don't know exactly who we service. It's very, very unsettling. I like the transparency. So, you know, if you can please like help me clear out that part, like I like transparency.
So specifically for the
Opioids.
yeah, so
When we deal with that, we have the harm reduction program here. I have no idea where's that money going
so
to.
though it shows up on our budget sheets, and it probably shouldn't because we have not had any harm reduction monies for several employees for several years. All of the funding for that is year by year, and as the grant changes, we actually could not. So harm reduction program usually is an equivalent of a syringe exchange program, and that now requires that the county commission approve it. So this was one of the and it's under several, you know, guidance, and this is an area that had been that it could be, this is allowed by the state, but now it's only allowed by the state if each county approves it, which then can change with an election if you have a majority, so it makes it very hard to embark on a program. Berkeley County still has, they were able to start theirs in 2017. And they have kept going, and do an excellent job. Several other counties that had them have had to close because they did not have the votes for their county commission. So it's not simply the health department deciding we want to do this.
Right.
And-
It's just very unsettling for me to see that we spend this amount of money, we hire this amount of employee, but we don't show who we service. It's very, very unsettling. I don't like that at all.
Are you talking about individuals that were served?
We don't need name. We need how many people we service, what time or the date, at least that.
I think that's where we start running into some HIPAA problems. Because if you're in a county where only 23 people died of opioid use, and you identify the day and time that it occurred and the QRT intervened, you're going to be able to identify that individual.
So when we have a
So-
functioning,
COVID dead, doesn't matter.
yeah, when we have a functioning quick response team, which is to respond to opioid overdoses, then we will have to report to the state, various data, all that data should be available.
What is encompasses the opioid that is in overdosing? What is an opioid?
So essentially it's a narcotic.
Well, I
It's
know
an
what
old
it is,
term.
but what is in that class?
So
Is it painkillers
So
and is it all pills?
So it's a subcategory, opioids are a subcategory of all drug overdoses. But it's the opioids, which is morphine and any derivatives, heroin,
Right.
okay,
So heroin's included.
fentanyl,
That's what it's
fentanyl,
trying to get.
and a whole bunch of other ones. They keep changing it.
Because not only is fentanyl appearing in the painkillers, it's a painkiller, but it is being used by drug distributors, illicit drug distributors, to spike heroin and cocaine. So there are people now that are dying of overdoses because of the fentanyl that's in those illicit
Or getting
drugs.
used.
Right.
Well, it's
So-
even happens, been found in marijuana too, where somebody takes
Oh.
a hit of like a vape of it, and it's been laced. So there's been that kind of stuff that's happened too.
Right, so that's really why I was asking the question. What I was trying to get at is that, we're talking about opioid overdoses. The main culprit now seems to be fentanyl that's being used in all of these various opioids.
So it's the equivalent of putting high fructose corn syrup in everything you buy. It adds that.
Now,
that's
stop
still-
picking on the
No,
sweet.
no, I'm just saying, it's there. And, no,
that. I like
don't, yeah.
Uh,
Yeah.
An opioid
So,
and
so
fentanyl.
whether it's harmful or not, it's a separate thing, but it's, it's there and you don't know it.
Right,
And in this case, you can't look at the ingredients, because you're just getting that. pill.
You're not, right, there's no label for
The
that.
counterfeit pills look identical to the name brand narcotics. There also are, colorful pills specifically marketed to kids and teenagers, and that's who they're designed to. And the concern is that unlike giving yourself an IV injection of heroin, which is that's a big hurdle. Taking a pill your friend suggests,
Or
or
snorting.
smoking weed
Mhm.
that
But there's
has been
people-
laced with it, you
there's
don't know
people-
what you're buying out there.
There's people who snort cocaine and heroin.
Didn't know what you were getting when I was in college. You assumed because your buddy would give you something that it's whatever they said, and how would they know?
Right.
It's it's a big problem now in that if you say, I don't use heroin. Well, no one does anymore. It's almost all fentanyl,
Right,
but it's now if you get sedating medicine or stimulating medicine, so if you get cocaine or this used to be called speed,
Mhm.
that mostly now has fentanyl in it. There are fentanyl test strips that you can test how much they influence whether someone's gonna take what they have at the moment is harder to know.
What
So
about-
it's a big problem?
Well, when you talk about drugs now, what about meth? I mean, every once in a while, a house will blow up, right? I know that-
That's so 2000s.
So so methamphetamine, it's never hit this part of the state as it has the southern part of the state, but there are other stimulants, Molly's is the,
Yeah.
is, but so there are all sorts of different chemicals. They keep changing it. The legislature has to keep upgrading which chemicals are now illegal because it's not on the list. So it's, yeah.
Cause like, wasn't Molly's the synthetic marijuana, like that they started producing?
So the Molly's. So we'll, if you would like for a meeting,
My side gig. I'm just kidding.
we could get someone from law enforcement to, we'll talk about what's out there.
Sure, I think that'd be cool.
I have
That
a
would be
question.
Yeah.
Is there any way that we can use, not us, but that grant that the money from the lawsuit? Can we use, can somebody use the money to open a rehab center here in the Panhandle? We need one badly.
Yeah.
And I've been working on it. I want to volunteer. I volunteer my hours to work at the center if we have one. But it's so difficult and nobody want to tackle it.
So actually, the state has done quite good in that they made some monies available back again around 2017-18.
I know Alex.
There were
really
no takers from the major players of the hospital system, mental health systems. But Dr. Parkins, who was a psychologist at the VA, who has an entrepreneurial bent with peers, he went ahead and got a group and applied for it. And they have built what's called Mountaineer Recovery.
What is that?
Mountaineer Recovery, it's across from the VA.
Oh,
And it has, I can send some information and
I had no idea.
that may be, also another person to give because they're right on our border, they happen to be in Berkeley County.
The gentleman that
And so they have
serves on the.
an inpatient long-term facility, another, private, addictions counselor applied for and got, again, the state grant money. Almost all of their clients are Medicaid. Got a state grant for an acute rehab, or a detox center. That was financially hard to keep going, and then COVID came and shut it down. That has just been transferred ownership to West Virginia University of Medicine, and they're opening it with an expanded program. So WVU has a huge interest in this now and are really coming forward. So we know, but still there are people who have to get a rehab bed. They may end up going to Huntington. Before that was always the case. So I'll get you some articles on this, and Dr. Harchins may be interested also in giving because this was the big issue prior to COVID, and it's the big issue, it's still there.
Yeah, I know we've been working on it and it's so difficult to open one because there's so many regulations.
I am talking with the school nurse and the others that so anybody can have Narcan, as you and I have talked about. So the Jefferson County Schools, we're talking about having naloxone or Narcan available in the school system. There are various programs. The state is coming out with some not guidelines. They already have some guidelines, but they're going to come out with some template policies. We're going to try and do things, the school system to try and do things so it's similar to what Berkeley and Morgan are doing. So there's some consistency, but it's an issue.
Why don't we just?
Yeah.
Do you have any question? Why don't we just hop into your health officer report then?
So I do not have too much different to say. That we continue to do vaccinations. We no longer have to do much in the way of the contact tracing of COVID cases. That has well, the only cases, the only times are people involved in nursing home outbreaks. And that's just because that's a special situation. The nursing homes continue to have a case here and there, but so does every group of 50 people, because it's in the community. The wastewater treatment is not an important tool right now, but could be important. So that the analysis of what flows into the wastewater treatment plant is a way you can detect COVID. Well, we know it's there, so we don't need it. But it may be helpful for detecting other diseases. And we're talking with some of the other townships about doing it with their townships. Also, WVU has a grant, samples get sent there. And but Charlestown Utilities does do that. And it's interesting to see. We did, several of us went to the geologic survey, it used to be called the fish hatchery. So it's the fish research area in Leetown. And they actually, a year ago, did processed a lot of these samples under a CDC grant that was very impressive. They were one of the few labs in the nation that had the capability of suddenly scaling up and doing this rapidly. And, so they were right in our backyard.
Very cool.
So, but getting the opioid response is to be very important. Staffing, as far as getting our nursing, being able to hire them for the salaries that we can get, is remains a critical weakness. We have nursing, but we're hanging on by a thread.
Thank you. Moving on to environmental.
So, last month, there were about 117 inspections and site evaluations total, and 13 plan reviews. Last month, both of the sanitarians completed they took their final exam, and they also completed at least 1 week of on-the-job training. Alex finished her second week of on-the-job training earlier this month. Alex has been cleared for doing all inspections in the field. Savannah is primarily working on food, and she did have her week of food OJT. I want to do a little bit more OJT with her before I clear her to be working in the field independently with everything. We do have her working on some complaints right now though, so and she'll get her second week of OJT, I think, in December. So, and then working on hiring that other sanitary position so they can be in before the training starts in February. So last month it was primarily me and Lexi doing everything. So, and we also were out of town for a few days for a conference. So, and I was out of town for a week for my sister's wedding. So.
Clinical activity report.
I have a question about the complaint while you worked on it. So, I got, I think 3 of us get a complaint from one of the coffee shop about they have dogs in their establishment, and you say that they're not allowed to have dog, even though it's a food, they sell things up pre-packaged, there's no open food.
They're a coffee shop beverages are considered food in the food code, so it's a food establishment.
That's fine, but many of the coffee shop, I go here in town, in Jefferson County, even Berkeley County, they have dogs sitting inside the shop. Are we gonna enforce everybody, or we just like
We
tell them
are
what business?
enforcing it every time we get a complaint about something, and every time we see it. We can't do it other than that. We are enforcing it. I've sent the information out to everybody. They're all aware. that they are not allowed to have dogs unless they request a variance. There is an option for them to do that at the state level. Nobody has done that. So the state could approve a variance, but it would likely only be done for outdoor dining areas. I know that there is some possible legislation for actually adding exceptions to allow dogs in outdoor dining areas. But that won't be until they adopt the new code, and if it does get added to the new code.
And
The
this
federal-
was the owner's
federal
dog, it's not even the customer dog, she just happened to walk the dog by.
If the dog's not allowed to be inside the establishment.
Well, it depends upon where you consider the food to have been prepared, so.
That doesn't matter either. The dog's not even allowed in the dining area unless it's a service dog.
In any dining area?
That's correct. That is in the food code, which is it's a federal code that the state adopted.
People have taken their dogs in there for at least 10, 12 years, so.
As far as I know, all the coffee shop I've been into in this town, even Starbucks and Panera,
So-
all of them have dogs in there.
You're.
I've never
I
seen
don't
a dog
know
in
the service dog.
I'm confused. Help me out here. You said the state code says clearly that it's where food is prepared. And now you're saying it's where it's eaten?
No, she said prepared for earlier, that coffee is considered a prepared,
Yeah, that's,
Well, it,
that coffee's under that.
I'm talking about
But
the
you
fact
said in
that
the
they
dining area.
considered a food establishment because they do prepare coffee. That is considered, beverages are considered food in the food code. And our food code also states that you cannot have a dog inside a food establishment, including in the dining area, unless it's a service animal. And service animals are only allowed in the dining area. They can't be anywhere where they could contaminate food that's being prepared.
so this is considered, those are considered, that they've prepared food, right? Because they serve coffee. Is that what you're saying?
That's correct.
So.
That's why they need a food permit. So, and they would still have to have a food permit for the retail operation, and they still, even in grocery stores, they're not allowed to have dogs. We know that people bring them in there and they do their best to try and keep them out. But it's an ongoing battle because more and more counties and things are allowing dogs in outdoor dining, but it's still usually just an exception for outdoor dining. Now, last year, yeah, they added an exception for basically some alcohol establishments to allow dogs inside the dining area of alcohol, certain alcohol establishments that are defined by ABCA's regulations, not ours. But that is the only exception right now. We are told that there may be another exception coming that may be added to the new food code, and if we adopt the new food code, then that exception might be in there for outdoor dining and allowing dogs there.
So
But right
are
now,
dogs not
people-
allowed in outdoor dining now?
No, they're not. So they're not.
When you say we, meaning the state of West Virginia adopt the new.
That's
federal
correct.
code.
That's correct, not us as a
The federal
county.
code we have now is from 2013.
That's correct. And 2013 and 2017, both don't allow dogs in food establishments, so.
Well, in order for the federal code to take effect, the state has to adopt it.
So
So the
the
state-
state specifically dog and a cat?
No,
one?
no animals, it's no animals,
Parakeet.
no animals.
No animals.
So they are doing things like catteries, but the cats have to be separate from. Like, if you've seen the cat cafes in some cities, like I saw one in Washington, and everything's completely separate from where the food is, but.
So we respond to complaints that we get, about whatever we, regulate. I get complaints sometimes about medical facilities that I do not regulate or something that happened and I discuss with the person and when appropriate, I will speak to someone at the establishment. But I have no regulatory authority for any of them. And then when, the environmental staff responds to these, they evaluate and they go according
Yeah,
to
we
what's
try.
required by the code. Which, like all codes, it's like, what do the details say?
And also on your website and our website, the board used to be on it, and there's a hyperlink for people who want to contact the board. You know, it's transparency, so is that section has been taken away, I don't see our name on that. I have, I got complaint from that, say, how do we contact you? Just happened to be a friend who looking to complain to the board.
I think
and
that's
they
something
just
we
get-
can solve with staff, that's not an advice item, so we can solve that with. So I thought we had like a link where it all goes to all of us, like that's what we set up a while ago.
There.
So
Okay.
you are all listed on a page.
Uh-huh.
All you have to
Are you
look-
not?
Yeah, you just go to the about section of the, and you're listed all there. So,
But like, I
but
think,
there is no direct link to any emails for you.
but there
That's
used to
right.
be a link for JCBOH and it went to all of us. Is that gone now?
You know, there's also that is available. You can do that. It's on the website.
Yeah, okay,
It's right on the agenda, on the agendas.
okay. So
It
that's still
says it
there.
right here on the agenda.
Okay. Thank you.
You may want to make it
Right
clear
there.
for
You
people
can go to the
to.
website or you can go to the YouTube channel,
Put it on the contact section
there.
so that they can find us.
email Jefferson BOH@westvirginia.gov.
Okay,
Says it on every agenda.
so why don't you just follow?
I'll drop it onto the bottom of the about page.
Thank you very much. We'll move on to the clinical activity report. Actually, that's what we just did. Sorry.
You did, yeah, you did environmental.
So the only update I have for you is I went to an emergency management conference down in Savannah. Met with a bunch of public health emergency planners and people from all across the emergency management sector. And so I left there on Veterans Day and came back last night. So yeah, I guess yesterday mid-afternoon because I stopped by the health department. And,
Get to go to the beach.
a little bit, yeah. It was.
Is it cold?
So Saturday and Sunday it was really nice. Monday, where I wanted to go, was pretty cold. Monday, Tuesday, Wednesday, it wasn't.
You got to fly in during.
Now it wasn't like it was. It wasn't like it was here, but it was like 50s and 60s. So that's
Great. All right, next meeting, December 9th. I think Gino had recommended maybe we skip it for the holidays. I know I'm not gonna be here now because of the holidays, because I have a work trip, I'm gonna be in Indianapolis.
So unlike the last few years, this is, there's nothing crucial business. It's really at this point a regular meeting. I don't believe we have any old business items that will be except the recruiting issues.
Always recruiting.
We need to meet 6 times a year. At least, and so being off in December is not a given tradition, but we have the opportunity to do it this year.
We can meet for a holiday party.
Yeah, yeah, Zoom. But it's.
I'd be happy to make a motion to defer the next meeting to January.
I second.
All those in favor say aye.
I.
Aye. All right,
So the next meeting will be January.
Yeah, I don't.
13.
It's fine.
So January 13 is the day. Friday the 13th.
It's okay.
23.
That doesn't scare me.
all right, well, thank you. I guess, sorry, do I have a motion to?
Move to adjourn.
All right, is there a second?
Second.
All those in favor say aye.
Aye.
All right, thank you. Meeting is adjourned. Thank you all.